first, going back to the pandemic recovery, in 2021 you toured the state, occasionally to some heckling from the audience, and you pushed Arkansans to get vaccinated. However, only 54% of the state remains fully vaccinated. Do you think that your push convinced more people to get the shot, and did that aid Arkansas's economic recovery? And is there anything that you might have done differently if you were able to go back?
Well, I think it was successful. I'm the only governor that I'm aware of across the country that had town hall meetings on the importance of the vaccine. And there was a lot of resistance, and there continues to be a lot of resistance. But what we learned was that who do people trust? And it's their local doctor. It could be their pastor as well. And so you put those people together in a town hall meeting and you hear the resistance, then I ask people locally that people trusted to respond to it. And so it was education, it was information, it was answering tough questions. So I think it did make a difference. But we had confusing messages at the national level where science was dismissed, where conspiratorial theories were embraced. And that hurt us in a state such as Arkansas. And so, we worked through it, but the fact that we were able to increase the vaccination rate certainly helped us to come out of the pandemic.
Mm-hmm. And unfortunately, your state still had some of the highest death rates from COVID, and the public health system is in the bottom 5 of all U.S. states. You're, recruiting talent to come to Arkansas, developing a workforce, but this sort of public health system might deter people from staying or moving into the state. What do you think needs to be improved in this system?
Well, we need to continue to improve access in the rural areas of our state, but also to change lifestyles. We're a southern state, and if you look at the states that have poor health outcomes, they're largely high poverty areas, Delta areas for our state, and we've got to change lifestyles. We've got to encourage more active living and better healthy eating habits. And so those things are important. But whenever you look at Arkansas, we were one of the first southern states that actually expanded Medicaid. And we did that, and I kept that when I became governor. And that helps improve the access to health care for our citizens, and we greatly increased the insurance coverage for every resident of Arkansas. We also have some excellent medical institutions from University of Arkansas Medical Sciences that has developing a cancer nationally recognized program. And so we're improving health care, but what we're seeing coming out of the pandemic was increased utilization of telemedicine, even in counseling services. And this helps us in a rural state to better deliver health care and make sure everybody has access to it.
Mm-hmm. And you mentioned encouraging outdoor activities. Would you say you're more of a hiker or more of a biker?
I'm more of a hiker, but I'm also a basketball player. And so I get my exercise in a lot of different ways. But in Arkansas, we're really investing in world-class biking trails in our communities. That's really become a national attraction. And so come to Arkansas, you can bike everywhere from the Delta Heritage Trail to some of the more difficult ones up in the hill country of Arkansas. Mm-hmm. And then but the hiking, we have state parks, we have 2 national forests, just beautiful scenery. When people think of Arkansas, sometimes they think of flatland, sometimes they think of the timberland in the south, but we've got incredible vistas, the Buffalo River, scenic river for canoeing. So our outdoor activities is another thing that draws people to Arkansas.